Appreciate it. I'm going to introduce Dr. Haynes before I speak. Dr. Haynes has been very active not only here but throughout the entire country when it comes to the Affordable Health Care Act and concerns she has with it in respect to physicians and patients. And so, Dr. Haynes, if you want to speak, and then you can pass off to me too.
Okay, that sounds great. Yes, I'm with Docs for Patient Care, which is a national physician membership organization, and I'm the senior health policy analyst for them. And I used to practice emergency medicine and then got involved the past 3 years with health policy because I'm concerned about the way healthcare is going in our country. And I'm concerned about the ACA. I think it's a tragedy that did not have to happen. It's a tragedy because it's not going to give us cheaper or more accessible, more affordable, and higher quality medicine. In fact, it's going to do the exact opposite for that. And that's because the government's policies are based on cutting back, on restricting care, on increasing regulations, which detracts from actual physician involvement and patient choice. So these are all going in the wrong direction. In order to get affordable access to quality care, we don't need to cut back. We need to create more goods and resources in medicine. It's the way the free enterprise system has always gotten us out of poverty or any place where there's been an absence of resources. We need to grow our way into affordability. We need to release the creative energies and efforts of all the medical entrepreneurs, not just in medical devices and new drugs, but also with innovative care and delivery systems as well. The other problem with there's many problems. We could go on for a long time about this law, but it's going to hit the most vulnerable citizens the hardest. And again, those are people who have low incomes, poor, the disabled, and the very ill elderly, because their solutions are all based on restricting care, not on creating more abundance. We've talked an awful lot in medicine about evidence-based practice of medicine. Well, I'd like to see some evidence-based health policy, because many of these policies that they're putting in, increased regulations, there's absolutely no evidence that they improve quality, and everything we know about economics indicates that it's going to drive things in the wrong direction. I can talk for a lot longer if you want me to. There's fabulous free market alternatives out there. I've got some friends who have a family practice in Florida who have a fantastic program called Epiphany Health. They're actively seeking people who are underinsured and uninsured. And for $89 a month, they will see people for 26 office visits for the year. That includes all their preventative care, and they're able to offer them extremely low prices for blood tests, $5 a shot. Why can they do this? Because they're working directly for the patient, they're cutting out the middleman. But to make that work, you need it to pair with catastrophic health insurance. And that's something else that this law is absolutely going to get rid of, is our ability to just get true health insurance instead of first dollar coverage prepaid health care, which is what the system has now.
Beth, I'd like to just add one point to that. I've been on the Carrier Advisory Committee for Medicare for the past 20 years. I'm actually the senior member. There's been a lot of jostling and third-party intermediaries. And CGS has taken over from Palmetto GBA, which is right here out near Polaris. But there was a situation in one of our meetings recent past where the radiology department, believe it or not, at OSU wasn't getting paid for the services they were providing. And the reason was they were asked for historical information the radiologists don't usually have. And so this debate got a little bit heated in the Carrier Advisory Committee meeting, and I said to Gary Oakes, who was then the director of CGS, medical director, I said, you know, in this country, we're innocent until proven guilty. And that stirred things up. And he came up to me afterwards and he said, you know, that's basically what CGS is telling us. Docs are guilty until they're proven innocent. It was interesting because one meeting after that, Dr. Oakes resigned. I think he was a straight shooter, and I think it bothered him as well.